This year I've been asked by ESMO to talk about two of the very distressing symptoms on cough and dyspnea. Unfortunately, these are challenging for patients with both physical as well as emotional implications for our patients, limiting their function and causing a lot of distress. So we'll be talking about some of the latest treatment options, both pharmacologic as well as non-pharmacologic, in palliating these individuals with these distressing symptoms. And we'll be also talking about the importance of doing symptom assessments routinely. And for these individuals, given that screening is the foundation to identify patients with these concerns, and also to identify any potential underlying causes. But given that many patients continue to have these symptoms even with optimal cancer treatment, we do need to be quite comfortable in managing these symptoms with a range of options. And one key recommendation, in addition to being aware of the literature, is to consider referring patients to supportive and palliative care because of the rapidly evolving evidence base for these therapies and the multimodal nature of these kind of symptoms, because they can be very affecting patients in multiple domains, and we do need the team with many different disciplines to support the patients better.